I'm a third-year doctoral student at the Institute of Health Policy Management and Evaluation here at the University of Toronto. My research looks at the costs of caregiving incurred by family caregivers of persons living with dementia in the home care setting or community dwelling settings. So I applied for the VHA Junior Fellowship program for a number of reasons. The first being obviously the financial support it would help, certainly as a PhD student. Also the connections that I would be making. So I've already made a number of connections through the organization. Dr. Sandra McCade, Catherine Nickel, they've been instrumental throughout this past year. My research is a mixed method study. There are a number of components, but the main bulk is twofold. The first is a qualitative study that aims to understand what are the costs that are incurred by family caregivers of persons living with dementia in community dwelling settings in Ontario. The second part of the study is a quantitative analysis that attempts to corroborate these qualitative findings. So I'm hoping to look at government instruments of data collection that look specifically at home care costs to see whether or not the costs that were identified by caregivers qualitatively correspond with those that are actually being collected by these government instruments of data collection. The costs that I'm looking at are largely out-of-pocket costs, transportation costs, home upgrades, respite care costs. But there might be some unique costs that family caregivers of those with cognitive impairment are experiencing. We don't know, and that's kind of what my research hopes to unearth. Well, I hope ultimately that these findings will inform strategies, whether federal or provincial, that aim to protect family caregivers across the board, particularly those family caregivers of persons living with dementia at home.